Hey everyone, I'm Dana.
And I'm Ashley.
And this is A Dash of PT.
So we're here today to answer some questions we got from our viewers and the blog we wrote regarding just in general what physical therapy is. And so we wanted to run through those and just have this accessible for everyone to look back on just to hopefully, spread some knowledge. So one of the questions we got is PT effective? And so this one was a little bit challenging to answer only because we're a bit biased because we think because of course we think PT is effective. And I think really we can be the first stop when there is an injury, just to really help you get better and help you learn about what's going on. That's kind of the main thing we really enjoy doing here at Smith PT is educating you on what to do at home, what's going on, and ways to prevent this from recurring in the future. So our goal is to get you better, but then also help you maintain that moving forward, which kind of leads us to a question that Dana got.
Yeah, I got a really great question from Christine who asked me, what do I do if I've been going to physical therapy and then I'm finished? Then what happens? Do I go back to how I was before or where do I go from there? Mm-hmm. And so I think there's a lot of different things that we can cover on this topic. But generally speaking, our goal is to get you independent with managing whatever it is that's going on with you. And we do that through a lot of education and a lot of instruction on exercises and things, different techniques and ways that you can manage your symptoms on your own. Because as much as we love you, we don't necessarily want you coming here for eternity.
Correct.
But also, we do have the option here at Smith for health and wellness visits, which I've had quite a few patients transition to when they don't really need the skilled intervention of physical therapy, but can still sometimes benefit from a little bit of hands-on work. I don't know who really couldn't benefit from a little bit of hands-on work sometimes. And so that's another option that is available too.
And just kind of steamrolling from that, just like you should see your doctor annually for a physical or just a checkup, really we can offer that here at Smith PT as well through discovery sessions. So these are free sessions for individuals and just to check to see if what's going on. So if you've been having this on and off ankle pain, you can set that up and we're happy to do that. There are some stipulations with some insurances, but those are few and far in between. And really it's just kind of a time for us to sit down and kind of recap what's been going on and talk about different options on ways to get you healthy. So that's another avenue that we can take.
We like to see people sometimes before there's a problem
Yes.
and work with you to prevent an injury before we're in too deep and then we're dealing with the injury itself.
Yes.
Yeah.
All
Did
right.
you get any other good questions?
I did. So a patient, John, had a question, and so he said, why do we look at video gait analysis or video analysis in general? And I would say it's not every single patient that we are doing video analysis on, but it does give us a way to take down or slow things down to look at how a patient is moving. So whether that's running, walking, squatting, and kind of look at the mechanics and break it down and show that to the patient on the TV and show them areas that we can improve upon. So for us, it's a great tool that we like to have from an educational standpoint and just from expanding our own knowledge base as well.
Yeah, it's a great way to demonstrate to the patient while they're sitting there and they can watch themselves because we tend to not watch ourselves move. It's hard to do and hard to judge the quality of your movement. But for a patient who might come in with back pain or hip pain, and we can trace that all the way down maybe to a dysfunction in the ankle and how all of that works together.
Stay tuned for a different little vlog on that.
That opens a whole new can of worms. So we're going to do a whole new series on that one also. But so video analysis is a great educational tool.
Yeah, we use it pretty frequently here.
Absolutely. So. Yeah.
Do you have another one?
I do have one more good one. And this question was, what do you do if your doctor doesn't feel that you need a physical therapy, but you feel like something is off in your body, whatever it is that's going on? And we are so fortunate in Illinois that direct access to physical therapy was passed. So up until this year, you needed a prescription from your physician to see a physical therapist. That is no longer the case. You can come right here and see us without an order from your doctor. We will communicate with your physician and your healthcare team, but we can be your first stop now instead of seeing the doctor first and hoping that they give you a prescription for PT.
Yeah, so it's been a great that was passed last year, I think you mentioned. And
Yeah.
so it's just something that's not well known that we are a direct access state. So, we're hoping to educate people on that, and now you are a little bit more educated on it as well. So.
Absolutely. And something else that we can do too, no matter what, is do a consultation or a discovery session with you, where if you're not sure if physical therapy is even appropriate for what's going on with you or not, you can come in and talk to us, and we'll take a look at what's going on with you to help guide you to whatever the right step might be it physical therapy or some other intervention that we think would be appropriate for you.
Yeah. So those were some of the questions we got after we did our blog post. And, feel free to reach out to us with any other questions on physical therapy and whether it would be beneficial for what you're experiencing or what maybe a family or family member or friend is experiencing.
Yeah.
So, and for next week, so just a little intro. So next week I wrote a blog on marathon burnout, which is a subject that's very interesting to me only because it's something that I've gone through myself. And so I'll be coming in live probably Tuesday just to introduce that topic a little bit more, and then you'll be able to find that blog on our website sometime soon.
So start thinking marathon training and burnout questions, because we
Yes.
want to make sure that we answer those next week. Yeah.
Of course. But thank you for tuning in, and feel free to reach out with questions.
Thanks, everybody.
Bye.
Bye-bye.